Anti-vaccine movements have emerged in Bolivia following the government's decision to impose restrictions on those who refuse to be vaccinated. Our correspondent Freddy Morales has the story.
The explosion of new coronavirus infections in the so-called fourth wave is accompanied by the emergence of sectors opposed to the vaccine and the new measures and restrictions. They infringe on the civil rights and fundamental freedoms of the Bolivian people, which are enshrined in the political constitution of the state.
We are upset, Brother Minister. We are not going to agree with the compulsory vaccinations. Brother Minister, we do not have the money to do a PCR test every 48 hours. Brother Minister, think about the indigenous peoples.
Teachers in rural areas have joined the anti-vaccination movement. The leading promoters of the campaign are evangelical churches, which claim that getting vaccinated demonstrates a lack of faith. Now they are also resorting to the courts in rejection of two decrees that make it compulsory to present a vaccination card or proof of a negative PCR test for all public and private procedures. As churches, we have decided not to abide by any decrees, the law. The government has warned that the country is facing the beginning of the so-called fourth wave, with a proliferation of infections never before recorded. Vaccination remains voluntary. Vaccination is not compulsory, and those who exercise their right not to be vaccinated must also exercise their duty not to carry new variants, not to infect people who have already been vaccinated. In the first wave, the mortality rate was 6.2%. In the second and third waves, it dropped to 2%. And in the current fourth wave, it is still less than 1%. What would have happened to Bolivia if we have had this number of cases without vaccination? It would have been the biggest mortality catastrophe. Like in the first wave, we would have had problems burying our people. We would have to dig mass graves, as in Beni, with tractors, to bury our population in mass graves. We are not seeing this despite having many more cases. This is the result of vaccines. The government, within the framework of new preventive measures, determined that a vaccination certificate or PCR test valid for 48 hours must be presented for any procedure in the public or private administration. Vaccination is free of charge, and there are sufficient doses for the entire population over 5 years of age.
Freddy Morales, teleSUR, Bolivia.